It's important to understand how to transfer a patient safely from a wheelchair to an exam table. Using proper body mechanics will help prevent injury to you and your patient. Begin by sanitizing your hands. Introduce yourself to the patient and identify him using two identifiers.
Hi, I'm Laura. Can you tell me your name and date of birth?
Oscar Dixon, 1160.
Then assess the situation. Can the patient stand on his own? If so, will you need assistance to lift him? Don't proceed if there's even a possibility that you might need help, and don't try to transfer a patient who can't stand on his own. If you are comfortable helping the patient by yourself, you can proceed. Begin by moving the patient's wheelchair close to the footrest at the base of the exam table. To give yourself enough room, position the chair at a 45-degree angle. Now, lock the brakes on the patient's wheelchair. Never transfer a patient into or out of a wheelchair without first locking the brakes on both sides of the chair. Next, move the footrests out of the way. Wrap the gait belt around the patient's waist over his clothing.
It's going to help prevent any falls.
Okay.
Okay, can I have you raise your arms up for me?
Make sure the buckle is in the front. Insert the belt through the teeth of the buckle and pull it tight to lock it.
Feels good.
The belt should be snug with just enough room for you to slip your fingers under it.
Rest your feet flat on the floor and your arms on the armrests.
Okay.
And I'm going to
Stand directly in front of him with your feet apart, back straight and knees bent. This position demonstrates good body mechanics and will help you avoid injury as you transfer the patient. Bending your knees, not your back, slide your fingers under the gait belt on opposite sides of the waist. Ask him to push up on the armrests on the count of 3.
1, 2, 3.
When you reach 3, help the patient by straightening up smoothly using your leg muscles, not your back, for support. Keeping your hands tucked into the gait belt, ask your patient to step up onto the
You
footrest.
step up onto the footrest
Then help him pivot and sit down.
and take a seat.
You can now remove the belt until the provider has completed the examination.
Send in right away, Mr. Dixon.
Thank you, doctor.
To get the patient safely back into his wheelchair, start by placing the chair at an angle, just as you did before. Once it's in place, wheels locked and footrests up, put the gait belt back on the patient. Stand in front of the patient, again back straight, knees bent and legs apart.
Okay, I'm going to have you rest your feet on the footrest.
Grasp the gait belt at the patient's waist. Ask your patient to push off the table on the count of 3.
On the count of 3, I'm going to have you push off the table and stand up. Are you ready?
As you did before, help steady him using only your leg muscles. Maintaining your hold on the gait belt, ask your patient to step down. Pivot him so that his back is to the wheelchair. Then bend your knees to help support him as he slowly lowers himself into the chair. Remove the gait belt once he's safely seated in the wheelchair. Remember to unfold the footrest and unlock the brakes.